Good evening, everyone. Thank you all very much for tuning into our live stream discussion. We have Allison Watson from the Margaret H. Rollins School of Nursing down at BB Healthcare. And Allison is going to give us some information about the Margaret H. Rollins School of Nursing, as well as answer any questions you all have. I know we actually just got a few submitted, which is great. So thank you very much for joining us, Allison. I really appreciate you being willing to share this information with students and families throughout Appoquinimink School District. Go ahead and take it away. You can just go ahead and get started.
Thank you. Thanks, Brandon, for having me. My name is Allison Watson. I'm faculty and student nurse recruitment at the Margaret H. Rollins School of Nursing at BB Healthcare, just south of you guys in Lewis. So today I'm here to give you a little information about our nursing program and the options as you as a high school student you have for continuing your education specific to registered nurse programs. So I'm going to share my screen for a presentation that I have. See screen, share. And discuss a little information about our program. So a little bit about our background. When you're looking at nursing programs, there's a variety of educational pathways. There's diploma programs like our program that's highly clinical based. So what you're doing in the clinical setting, you're doing in the classroom simultaneously. There's associate degree programs, say like the Delaware Tech system, and there's bachelor's degree programs like University of Delaware main campus. All of them get you to the end goal of taking your NCLEX, which is the national licensure for your registered nurse. It really picking the educational pathway that's best for you really depends on how you learn best. So like I mentioned with our diploma program, we're highly clinical based. So what we're doing in the classroom, we're doing simultaneously in the clinical setting. We have been around, we're getting ready to celebrate our 100th birthday in 2021. So a big celebration for us. We're accredited by the ACEN, approved by the Delaware Board of Nursing. And in 2015, we were able to build our brand new state-of-the-art facility on the BB Healthcare campus of the main hospital. Just seeing our school from a overview. The first floor is our classrooms. The second floor is our high fidelity simulation labs. And the third floor, we are actually expanding our simulation labs just because of that need with our students. And also it's very collaborative with our hospital. So our physicians, medical team, respiratory, all are utilizing our simulation labs as well, which is a great collaboration with our students. This is an example of one of our high fidelity simulation mannequins. What's really nice about this is it's all the same equipment that you see in the hospital setting. So you get that level of comfort and allaying a lot of those anxieties. So this, mannequin is on a ventilator, cardiac monitor, multiple IV pumps, the same bed, the same bedside table. So all anxieties that you have when it's a real life person, you can get more comfortable at the bedside using simulation. The big thing when you're looking at nursing programs, I highly recommend that you look at the NCLEX pass rate. That's really important so you know how prepared these students were when they graduated from the program to take their NCLEX, which is the boards. We're really excited that our class of 2020 and our class of 2019 were 100% pass rate on their first attempt taking their NCLEX. Despite the challenges that COVID brought us in the spring semester last year, our students were still able to successfully pass their boards on first attempt. So we're super proud of them for that. We are consistently ranked high in the state of Delaware, consistently above the national mean in NCLEX pass rates. We have small class sizes. So with our new school, we start about 50 students per year. Affordable tuition rates, which we'll talk more about. And the big thing being a diploma program is that we have more than 1,000 hours of clinical education. So our students are very comfortable at the bedside and transition really well to that new graduate role. As a high school student, you're in a really great position when it comes to nursing and the options that we have. We have a collaboration with the University of Delaware and their Associate in Arts program. So what that allows our high school students to do who are coming straight from high school into the college setting is they can do their first year of enrollment requirements with University of Delaware's Associate in Arts program. What's nice about this is you can utilize seed money, so that free education for that first year. So our students can take those enrollment requirements with University of Delaware's Associate in Arts program at their Dover or their Georgetown campus. You're with a cohort of students that all will transition to our School of Nursing in year 2 and year 3. At the end of that third year, you're graduating with your diploma in nursing and your associate in arts degree from University of Delaware. At that point, you're eligible to start working, take your boards, pass your boards, and then you go back to University of Delaware in the online format to finish your bachelor's degree. What's nice about that is now you're working, so you can use tuition reimbursement from your employer to help offset those costs to get your bachelor's degree. So year one, you're with University of Delaware in the Associate in Arts program, utilizing seed money, so free education. Year 2 and 3, you're at the School of Nursing. At the end of that third year, you're graduating, you're gonna take your boards, pass your boards, start working, and then you go back in the online format to finish your bachelor's degree. What we're looking for is a 2.75 high school GPA or better and a B- in your bios and chems. You can actually find our application on University of Delaware's website or BB Healthcare's website. And it's a very simple application. It's all electronic. And currently the application fee is waived until the end of the year. Priority deadline is January 15th. And I just recommend to any student, if you have an interest in nursing, this application is so simple that I would recommend just fill it out. So then when you are looking at all your options on the table this spring, you have another option in your backyard that could be the right fit for you. This is just a map of what it would look like taking those first year courses. We have two advisors from University of Delaware, Stephanie Shoup and Melvin Mendoza, who predominantly work with our students who will schedule your schedule for that first year. Year 2 is at the School of Nursing. So we have our Nursing 101, which is our foundational skills. Our students immediately start clinical, start learning how to perform assessments, medication administration, injections, IVs, and many procedures. And then we transition into that second semester, Nursing 102. This is where we start expanding on those med-surg concepts. So our students are completing procedures like nasogastric tubes, administering high alert medicines like insulin, and they also participate in clinical in the operating room, which is unique to that semester. The third year in total is still at the School of Nursing. Nursing 201 is our special population. So this is when the students participate in peds, women's health, and mental health nursing. The women's health nursing takes place at our BB campus. We participate in mental health clinicals, many observations in the community that focus on these clienteles. And also unique to this semester is our students start learning how to start IVs, which is very unique to our program. Most nursing programs actually consider that on-the-job training. So our students probably start about 50 IVs before they graduate from our program. And then our final semester is advanced concepts. So our students are taking care of many patients, multiple patients. They're in the intensive care unit. They're doing their trauma rotation. So this is really them springboarding into that new graduate role, ready to transition into practice. We also have a preceptorship. So for 72 hours, our students are collaboratively working alongside a nurse in a specialty area. At the end of that third year, you're awarded that diploma in nursing. You're eligible to take your boards, eligible for new graduate residency programs for hire. And our class of 2020 had 100% job placement. So all of them passed their boards on first attempt, and we're all able to successfully land jobs. When you go to finish your bachelor's degree, and this is what University of Delaware's RN to BSN completion would look like. You obviously can pace this out to what works best for your schedule and utilizing tuition reimbursement from your employer. Looking from a cost standpoint, that first year as a high school student going straight into the Associate in Arts program, you can utilize seed money. That's free education. Year 2 at the School of Nursing, year 2 and 3, we're approximately $7,500 per year. We do take federal funding, financial aid, and honestly, the community of Lewis and the community surrounding BB love our school so much that we offer quite a bit of scholarship opportunities once you have a seat in our class. I say if you're working hard and have a seat in our class, there's really no reason why you shouldn't be eligible for any of our scholarship opportunities. Also, during the summer of year 2 to 3, there is a competitive option to have a paid externship where you work as a tech 1-2 days a week, and then you shadow the nurse in that area that you're working 1 day a week. And this is paid for 10 weeks. This is a great learning opportunity and oftentimes set the student up for job opportunities in the future. And then year 4, you're working. So you're utilizing tuition reimbursement. On average, most institutions offer about $5,000 per year for full-time employees. And what's nice about that is it can be self-paced to utilize monies or to fit your lifestyle. We have a virtual open house since we can't be face-to-face. So I appreciate everyone coming and logging on tonight. But we have a brief open house that just gives you a little tutorial of what our school looks like. I'm going to play that. Don't do this to me.
It looks like the sound's not coming through, Allison, but if you want to send me the link to that, I can always post it in the YouTube feed, so it's there when people go to view the video.
Yeah. No. Can you still not hear it?
Yeah.
Okay.
Which is fine. You can always you can send the link to me through the Zoom if you
no
want
problem.
right now. That way you can kind of keep going.
Yeah, I'm just trying to make it back. Easy. Pause. Sorry about that if you can't hear the virtual open house video. I'll be sure to send Brandon that link so you guys can see the link. It's actually a really well done video we just posted. So sorry about that if you can't see the video. I think I'm back up and running, screen sharing, and hopefully you can hear me. To wrap the informational session up, again, I'll send Brandon that video so you guys can see our open house and really kind of put eyes on what our simulation lab looks like and what our school looks like without being there. We also have another great opportunity for high school seniors. It's called the Academic Excellence Scholarship. This is for those that are excelling in high school, a high school GPA of 3.5 or better through 11th grade with an interest in health professions. We're looking, the actual scholarship is posted on our website for the essay topic, a letter of recommendation, and this is actually allowing the student to earn $2,000 towards that first semester in the nursing program. Because we know that incentive to use seed money for free that first semester, but this will go towards your first semester at the School of Nursing in year 2. And the priority deadline for that is January 15th. Again, you can find our application at bbhealthcare.org, click on Margaret H. Rollins School of Nursing, and there you'll see the University of Delaware dual partnership application. Again, it's a very simple application, so if you are interested in nursing at all, I really encourage you to fill it out because it's really just a great option that's close to home, that is affordable and is putting out really great outcomes. So our students, again, are ranked #1 in the state of Delaware, passing their boards on first attempt, getting jobs, and really transitioning well into the very vast world of healthcare. Certainly, if you have any questions, I'd be happy to answer them. Brandon is very familiar on how to get a hold of me. Again, my name is Allison Watson. I can be contacted at awatson@bbhealthcare.org, and I'd certainly be happy to answer any questions that anyone has.
Yeah, can you, I want to start with a question because you were just talking about the application process. So, because I feel like this is something we've had a little bit of confusion on with students over the past couple of years. They only need to go on and complete your application, correct? They do not need to apply to University of Delaware itself?
Yeah, great question. So if you are specifically interested in our RN nursing program with University of Delaware's Associate in Arts program and BB, you only need to complete that dual application. It's very simple. If you've already completed the Common App to main campus University of Delaware, that's fine, but they'll do a change of major form if you choose to change your mind and have interest in the Associate in Arts program instead of main campus. So if you already filled out the Common App, it's, that's fine. You can even get your notifications, your acceptance, all that. But if you choose to change your mind, it's a simple change of major form that University of Delaware admissions can complete.
And any students out there who may need to submit that change of major form, if you don't know who to reach out to at UD or how to go about it, just reach out to your school counselor. We all have contacts at the university. We can all reach out to them on your behalf, or at least provide you with their email addresses so you all can do so. Another question, you already mentioned it earlier in the presentation, but for our younger students and families, because this is such a wonderful opportunity, right? Students can get their nursing certification in 3 years, begin working after 3 years for a fraction of the cost of a 4-year degree.
Room and board.
Yeah, that's right, correct. But for our younger students, especially who may be interested in this program, can you kind of go over again the academic requirements? Because I know we have students who take certain science courses. It could be 9th, 10th, or 11th grade, but just so they know what they need to aim for.
Yeah, in order to successfully be prepared for nursing, any nursing program, nursing's a rigorous major. I would definitely say be prepared for your sciences and your maths, because that's really going to be your cornerstone. So your anatomies and physiologies, your chemistries, your biologies, all those are really good foundational courses. If you have a course like medical terminology, that may be helpful as well. We certainly transfer any credits that you may take for advanced placement as well. So if you are one of those students that utilize the anatomy and physiologies, the med terms, in addition, some of our other courses that are enrollment requirements include sociology and psych, which I know oftentimes students take with advanced placement. So all those are great to start building up for those credits that can transfer to your college education. But the big thing with nursing is your sciences. So take those serious in high school, really kind of hone in to anything that you can take in those medical pathways. Some schools I know offer medical tech or a CNA or an allied health program. Get involved with those to really see if this is your niche and your interest. Because a lot of times, we haven't touched or seen patients or cared for patients and we go into the nursing program. So a lot of times it's nice to actually have some of those exposures. I know it's a difficult world right now, but volunteering, shadowing other nurses, really kind of just putting yourself out there to see if this is an interest for you. And that's what's really great about nursing is it's not just bedside nursing. There's education, there's sales, there's leadership, there's bedside nursing. And when you go into bedside nursing, there's so many vast specialty areas to go into, from mental health to critical care to the operating room to women's health. And then also with nursing, you can advance your career to a nurse practitioner, a nurse anesthetist. There's a variety of avenues when it comes to nursing. So you're really, truly never locked in. And I even say this to some students who don't know if nursing is exactly for them. What's nice about the Associate in Arts program is you're not locked in. So say you apply for our nursing collaboration or cohort and you're in that cohort, but after the first semester you take anatomy and you're like, this isn't for me. That's okay. You're not locked in. You're taking a lot of the general education courses that people are taking on main campus UD, but you're getting them for free. So you can always transition to main campus University of Delaware like traditional Associate in Arts students do. So I always just say, don't let that intimidate you that you think you're locked into a major, because you're not.
And something you just mentioned actually is a good segue into one of the questions we got on the Google form. So the student asked, like, what are the specific nursing fields you offer and what other schools may offer? And I believe what they're kind of asking is different types of nursing, right? Working with different populations or different specialties. And I know you kind of just touched on that. So can you just elaborate a little bit more about, what a nursing program in general does for students, and then how they would go into one of those more specified fields afterwards?
Yeah, so specifically at our program, we start clinical, week 2. So you are in the clinical setting. So predominantly Definitely most of our acute care clinic floors, the telemetry floors, the step down floor. And then depending on what semester, when we go into special populations, you're in the women's health. So OB or maternity floor. In pediatrics, our students actually also go to AI DuPont and do their peds rotations, a lot of community health, population health. We go to the emergency department. We go to the intensive care unit. Our students go to the operating rooms. They go to the cath lab. They really get a wide variety of every specialty, wound care, every specialty that we have. Tunnel Cancer Center. Sorry, they're all coming to my head. We go everywhere when it comes to actually the clinical settings at our program. And certainly that is something when you're looking at nursing programs to kind of look and see what their clinical assignments look like. We're very fortunate that we're hospital based. So our clinicals, we really get priority from a student standpoint. We get, I don't want to use the word free reign, but we really get a lot of accessibility to all the specialty areas. And while some places it may be that you're at a specific hospital for a few weeks and then you go to a different hospital. So what's nice about us staying consistent is our students transition really well when they're a new graduate. Simple things like knowing where the linen room is, the cafeteria, x-ray, things that are very anxiety provoking as new grads, our students have already kind of mastered that. When it comes to your career in nursing, like I mentioned, I mean, it's really endless opportunities, whether you're going to be in bedside care, leadership, education, marketing, sales. There are so many. Now you can work from home doing insurance, and there's a lot of varieties when it comes to nursing.
Thank you. And I know, so I just, another tech learning minute for me here a minute ago. I know I had put the Google form in a live chat on the YouTube feed, but we still have a group of people watching. And I realized that since they've logged on, they may not have seen that since it was in the chat before they logged on. So just to let the people know who are watching right now, I did put the Google form in the comments below the video. So if you have any questions for Allison, you can go ahead and click on that Google link and submit those questions right now for a few minutes while I ask Allison another question.
Yeah, sure.
So that way it gives everyone watching a minute or two if they want to submit questions. So I know you're all located in Lewis, right? And you had already mentioned that students who go into your cohort through the UD partnership, especially if they're in Newcastle County, are most likely going to take their first year of classes at the Dover Del Tech campus. But I know you have people, so I'm in Appoquinimink High School and Appoquinimink School District in Middletown, but I know you've also had students come to you from north of us in the Newark area or even more north of that. So can you go into a little bit of an explanation of, even though they may take their first year of classes in Dover, what do they do after that when they come down to BB? What do you have students do? Do they drive back and forth? Do they get houses? Is there housing? What does that look like for them if this is something they want to do?
So interestingly, in the last few years, Appoquinimink in the Middletown area and in the Newcastle region is very popular area for us. We have a lot of students that are coming down from that area. Oftentimes what I'm noticing is they either have family down here or their grandparents have a beach house, that kind of thing. But many of our students, some I will say, like we have a student right now that lives in Townsend and he commutes every day and it works for him. It's straight down Route 1. He doesn't mind it. But there are other students that come together that meet during that first year when they're in that cohort, and they come together and they get like a townhouse in Lewis or at 5 Points. We work with local realtors. Some people end up getting these like fantastic beach houses on the Delaware Bay that people just don't want the pipes to freeze all winter. So they get these cheap rentals for off-season costs. So that's what's really nice about year one is you kind of meet and develop these relationships, and then you can find housing with them down here if you want. But certainly the option to commute is there. We don't really recommend more than an hour commute just because clinicals are early mornings. I mean, that's a toll on you to commute every day, but certainly it works for some people. And then obviously there is that option to rent in the area. We find that a lot of students do that well. They meet 3 or 4 friends and it's still significantly cheaper than room and board at a university.
Awesome. Thank you very much. I wanted to make sure I hit on that because I know that we have students from the Middletown area coming down to you. And I'm so happy that we've been able to get some of our students into your program just because it is such a wonderful opportunity to save not just a little, but a lot of money as well as get to work pretty quickly.
Yeah.
So we did get one more question come in. Somebody commented that they're still a little unclear as to what applications need to be filled out for this nursing program. So I don't know if you can touch on that a little bit. I don't know if
Yeah.
if you want to share your screen again, even show them on the website maybe where they can find the application.
Yeah. So if you let me screen share 1 second. Let's see. I'm sorry. There is a fly buzzing around my head. Let's see. Let me do this. Get out of there. Sorry, I was telling Brandon earlier, my Microsoft just updated, so I'm getting used to all the new tabs. So if you go to bbhealthcare.org, and then you can go to the Margaret H. Rollins School of Nursing.
Can you share that? Can you share your screen?
Oh, am I not sharing? I'm sorry.
No.
Let me find it again. Let's see. Share screen. My screen. Share.
Showing your home page. There you go. If you click on.
Yeah. Where is my? Let's just go to this. See if this will work. Is it still sharing?
Yeah, but it's still sharing it. We're seeing the
Okay.
Zoom link. There you go.
Okay. So I was at BB Healthcare, and then let's see here. If you click on the right side, you'll click Margaret H. Rollins School of Nursing. And then here you can actually scroll down to admissions. And then you can click on the University of Delaware dual application. And this application will link you to them, which again, you do have to do a My Blue Hen account. And then it's a very simple application.
So if somebody, what's great about this is that if they want to do the partnership with UD, they go right through the BB website. They can click on admissions, UD partnership, and then fill out the application that way. I do want to let people know there is also an application on University of Delaware's website. So if you want to go through University of Delaware's website, the admissions page, first year applicants, there's a little piece, if you scroll down, about the partnership with the Margaret H. Rollins School of Nursing, so people can find the application through UD's website or the BB Healthcare website. And I do want to reiterate what you had said before, Allison, that if somebody has already applied to UD on main campus, but this is a program that they want to that they would like to switch into, then they can either reach out to their school counselor or just the admissions office at UD and work on making that change.
Yeah, and our contact there is Alejandra McFern. Certainly I can give you that name, or Mr. Townsend can give you that name, but she's who's in charge of admissions for the Associate in Arts program in our cohort. So she is always busy working in the spring doing change of major forms for that issue. Because I understand people want to see what all their options are. So if they're filling out the Common App, waiting to see what kind of offer they get, it only makes sense.
Great. I don't see any other questions as of right now on the Google form. So I think we're just about close to wrap up. I really appreciate you taking the time to present. And the fact that this is now going to be on YouTube, first timers right here.
I know. Are we like YouTube famous?
I wouldn't get ahead of ourselves, but what's great is that,
followers.
Yeah, is that what's great is that this video will be available for folks. So if somebody's watching this right now and they want to refer back to it later, they can always come back to my YouTube channel and see it. And we will also make sure that you have it, Allison, to make it available. And we'll try to get available to everyone else out there, whoever wants it. Is there anything else you want to share or talk about, or last things? Just to...
Certainly, if anyone has any questions, comments, concerns, please reach out to me. Mr. Townsend has my contact information, Allison Watson, awatson@bbhealthcare.org. I'd be happy to answer any questions for you. Email is probably the best way to get a hold of me because I'm in clinical half the week and then teaching the other half. So email is probably the best, but I'd be happy to answer any questions that you have. Again, if you have any interest in nursing at all, I highly recommend completing the application, giving you another option in your back pocket. Certainly look at the video that I was unable to share of our virtual open house, just to get a feel of what our campus looks like. Again, we're a smaller campus, but we're highly clinical based. So what we're doing in clinical, we're doing in the classroom. And our numbers prove that our outcomes have been well for celebrating 100 years now. We look forward to seeing you and answering any questions. And currently with the restrictions that many of us are having with education, we're really happy to say that we've been face-to-face since mid-August. So our students are still completing clinical. We're in the classroom maintaining the guidelines that are recommended to us. But we've been actually, doing really well with the restrictions upon us, and our students are still getting valuable learning experiences. So we're excited that we can continue that trend throughout this pandemic that we're involved in as well.
Thank you so much, Allison. I want to thank everybody who's watching this or anybody who watches this in the future. And again, everybody out there, whether you're an Appoquinimink School District student, family, or not, if you have any questions, you can reach out to Allison at awatson@bbhealthcare.org, or you can reach out directly to your school counselor at your high school, and we will connect you however we can and get you any information that we can as well. So everyone, thank you very much for tuning into the live stream. We hope it's been helpful. If you have any questions, please send them our way, because we want to make sure that everyone is as educated and empowered as possible to make sure you're making the best decisions for your futures.
And Brandon, thank you for having me. I appreciate you organizing all this.
Yep. Thank you.